This is a Relay Project.
The Discourse starts right now with Cheryl Oates and Erica Barudis.
Welcome to The Discourse. On today's show, we're digging into Premier Danielle Smith's parental rights policies.
The Premier announced the new policies in a produced video on X last week, and the next day, she held a press conference.
For children who identify as transgender, I want you to also know that these policies are being implemented in order to protect the choices you have regarding altering your physical body until after you've grown mature enough to make such choices safely and with a full understanding of what that means for the rest of your life. These policies include a prohibition on gender reassignment surgeries for minors aged 17 and under. For children aged 15 and under, puberty blockers and hormone therapies for the purpose of gender reassignment will also not be permitted, with the exception of those who've already commenced their treatment at this time. For minors aged 16 and 17 who wish to start hormone therapies for gender reassignment purposes, this will be permitted with parental, physician, and psychologist approval and consent. Children aged 15 and under will require parental notification and consent before their name or pronouns are changed in school. For minors aged 16 and 17, parental consent won't be required for this, but parents will have to be notified. In rare circumstances, when transgender children experience an abusive parent, there are, of course, child protection laws that will be enforced. And lastly, we are implementing policies to protect fairness and safety in women's and girls' sports. We will work with sporting organizations to ensure that women and girls have a choice to participate in competitive sport without having to compete against biologically stronger transgender women athletes, while also ensuring that we work with those same organizations to expand co-ed and gender-neutral categories so that every transgender athlete can meaningfully participate in the sports that they love.
The announcement has been controversial and has sparked debate from both sides, as well as responses from a range of medical professionals and other experts.
This is a topic that carries a lot of emotion, and today we hope that we can have a fact-based conversation about what the government is proposing and what its implications are. I know that Cheryl and I have spent the weekend sharing articles back and forth, doing a lot of reading, listening, and speaking with individuals on both sides of this conversation, and that we're both looking for a solution that demonstrates love and compassion of those involved and impacted.
In order to do that, we need an expert. Today, Dr. Joe Raish has agreed to join us on the program. Dr. Raish is a Calgary-based psychiatrist specializing in work with transgender youth and adults, and he's helped build gender clinics at the Foothills Medical Center as well as Alberta's Children's Hospital, and operates his own clinical practice. Dr. Raish, thanks so much for joining us.
Thank you for having me.
Of course. I think to open up today, just maybe a little bit about the work that you do and any initial thoughts on the policies that have been rolled out by the government of Alberta.
Yeah, absolutely. So I'm a full-time psychiatrist working almost exclusively with trans youth, families, and adults. So that's the entirety of my practice. Mostly our support is around helping folks navigate the more medical or surgical aspects of their transition goals. So our clinics, certainly don't aim to see everyone because not everybody has that as part of their own personal goal. But those who are interested, absolutely, we would be involved in supporting them kind of reach their healthcare needs. So the announcement from last week from government, I think caught a lot of healthcare providers and educators off guard. Especially the length that some of the restrictions on gender affirming care, especially with youth, and putting in sort of arbitrary kind of age restrictions, it was concerning, and I think there's been a lot of kind of vocal feedback. And statements released by the Alberta Medical Association, section of pediatrics, section of child and adolescent psychiatry, the Alberta Psychiatric Association, all in the last week, releasing position statements that these proposed policies really don't align with best practice, with evidence-based care whatsoever or any international consensus guidelines. So it was a shock. It's very alarming, and I'm happy to be here today to talk about that.
And I do want to come back to what you said about some of the alignment with our current form of how we enter into this space. But one thing I wanted to bring, and I think we kind of blanketed the announcement. Can I maybe get you to comment, because I haven't seen some of the other policies be introduced, or even by opposition leaders, that the government announced that they would bring in medical professionals to Alberta. That is part of this policy, to specialize in the pre and post. I just want to read it so I don't get it wrong. But post-operative transgender care for adults in Alberta, and further to that, would develop a private registry of medical professionals who specialize in this field. Can you maybe comment on that part of the policy, and where you think that is also headed?
Yeah, absolutely. I mean, so I think out of everything that was kind of announced, that maybe was the one item where there's perhaps a little bit of a silver lining. In particular, if the province is sincere and committed to improving access to care for trans Albertans, that having surgical specialty and expertise exist in our province, would be a great step in the right direction. So I don't think you're going to find much, opposition to that. I think where some of the difficulty might arise is, on one hand, you have a policy announcement that's saying, hey, we want to recruit somebody, we want somebody to provide this service in province, in-house. And at the same time, we're also going to simultaneously enact a bunch of kind of restrictive other policies, right? So I think those clinicians, those surgeons working in this area want to be in an environment, they want to be in a setting where they're going to feel supported, where there's a good network of colleagues, and that the sort of landscape of providing gender affirming care is more holistic. So it was a little interesting to kind of hear these policies released in that way. The other thing is this has been something that those of us working in this area have been advocating government for years about improving wait times for surgery, improving access to surgery, potentially having a surgical center here in our province of north of 4 million people. And time again, when these proposals have made their way to government, they've either been rejected or not even really considered. So it's also a little ironic now that that this is kind of coming to the light. So I hope government really is sincere in their desire to kind of pursue that, and that could be a helpful initiative as well to add.
Yeah. And so I think it's unfortunate, and this obviously not directed to you, but the AMA has come out saying a lot of negativity against the policies, and have yet to recognize what you did is a step in the right direction on some of the other things that maybe didn't make the media in the same way that some of the, as you said, the changes of age for hormones and post-op. I do want to ask you though, because you talked about the universal practice. We've seen a lot of changes recently coming out of the UK, out of Sweden, out of Finland, where they did go by gender affirming care and now are shifting towards exploratory care. So can you maybe walk us through like how we got to gender affirming care in Alberta and Canada? And, if we are also looking at that exploratory care model as we learn from countries that are farther down this journey than we are.
Yeah, absolutely. I'm happy to shed a little bit of insight, on that, Eric. And obviously, I'm a practitioner in Canada, so I certainly keep, abreast of some of the changes going on internationally. But I recognize I do not work in those jurisdictions, and that there's a lot of other kind of moving pieces to why some of those changes might be happening. But before I do, I really do want to clearly emphasize the difference between gender affirming care and what sometimes gets confused as a more purely informed consent model of care. So gender affirming care for us here in Alberta is about affirming someone's identity, their lived experience. But it's not just about, doing anything that somebody wants, right? Like we still have standards that we follow. We still have good practice, good medicine, where we're wanting to support, in this case, if it's a youth or adult, in reaching their goals in a way that's safe, that's healthy, and that's conducive for long-term success and hopefully, sort of a positive outcome, while at the same time minimizing the risk of harm by doing nothing. So it's always a delicate balance that's an individual decision based on the person and the family, sitting in front of us at any, given day of the week. Whereas informed consent very much is, kind of a no questions asked. I'm going to show up, I'm going to sign some paperwork, and I'm going to get my prescription for hormones, or I'm going to get, a referral for this or something else, right? There are jurisdictions in the world that do have that kind of model of care. And that model of care really was born out of necessity in some of those places because of how long wait lists were, the level of institutional gatekeeping to access proper gender affirming care were, that these life-saving measures, almost as a harm reduction strategy, needed to exist. And my hope is that in Canada, at least, we've struck a good balance between providing good evidence-based care that's supported by international standards, that it isn't necessarily a pure informed consent. I'm going to sign my life away, and whatever happens. So I hope that clarification and distinction is useful. Because it really is sort of different. So if we look though to your other kind of second part to that question of what's happening internationally, why we're seeing a shift back. So I think there's a couple factors in why that might be the case. First, I think there have been a number of high profile cases published in media, in particular social media, where individuals who have navigated their transition have come to express some degree of complications, some degree of regret, and perhaps even may retransition and now identify as cisgender. And so these get amplified, even though they're not the majority. They're not even close to being the vast majority of cases of youth and adults that we work with and see. But their stories are nonetheless powerful. And I think for someone who maybe isn't overly familiar with what gender affirming care entails, what it looks like, might hear this and be sort of shocked and, oh my goodness, like I can't believe that happened. I can't believe that would even be allowed to happen. So it really plays into this emotional argument around we need to be protecting youth, we need to be protecting patients, we need to prevent any and all possible outcomes where somebody may regret something, right? And I think a lot of the legislative changes internationally that are being attempted or being tried really are coming from that place. And so to use the UK for maybe a more specific example, historically there was one clinic in the whole UK that every youth had to go through. They had years long wait lists, and obviously, understaffed, underfunded. It really created a dynamic where patients maybe weren't actually getting the best possible care because they couldn't actually offer that. And instead, when they looked to kind of review things, they said, well, let's, the one thing that also I think is a bit of a kind of misnomer is this idea that these countries are banning care or they're restricting care. Well, I think, depending on your perspective, maybe there's an angle of truth to that, but I think a more accurate view would be say that they're actually looking at supporting and bolstering care, meaning that it's not just going to be one centralized place, that care is going to be decoupled from one sole clinic, that it's going to be looking at integrating gender affirming care into the community, into multiple clinics. It's also going to be ensuring that there are additional medical and mental health supports available for youth and adults who are transitioning. And that the third kind of layer is that there's going to be perhaps a research component, that these outcomes, these individuals are going to be followed a little bit more closely and rigorously, right? And I don't think anyone's saying that necessarily is a bad thing, but it's a little disingenuous when that gets presented as, they're outright banning care, and therefore what Alberta has recently suggested with our government, that somehow that makes sense or that's in alignment with the actual standards that exist working with this population.
There's a lot of emotion and there's a lot of fear around policies and advocates on both sides of this issue. And a lot of it comes from the not knowing. and the not understanding and a lack of information, because in the grand scheme of things, it is a smaller portion of the population that is experiencing gender dysphoria and is transitioning. And so not everyone has exposure to it. And there is this sort of narrative out there that, there could be a kid out there, a young kid who just comes to school one day and decides that they're not a girl anymore, they're a boy. And then somehow they just get plucked up and are now on hormones or moving into a system that will offer them surgery. And in reality, the process that they go through is so much more complex. And as it stands until this announcement, we rely on the expertise from professionals like yourself to sort of guide those individuals through the system. Could you offer just sort of a glimpse at what that looks like for those that, are worried about their kids entering school and maybe questioning their identity, and what those steps look like for them?
Yeah, well, I mean, you do bring up a good point, Cheryl, that this is not something that happens spur of the moment. These are not medical decisions that occur lightly or without consultation with parents or families. And that really the process of transitioning, if you look on average, it takes roughly 7 years, kind of start to finish. So this is a long, journey where it's not just, a snapshot in time and, we're going to kind of knee-jerk react to something. Often the youth that we see have been struggling with feelings of gender dysphoria for many years. Their parents are aware, their parents are supportive, and they're wanting to ensure that their child doesn't suffer or struggle anymore with needing to, for example, go through a puberty that does not align with their gender identity, or perhaps need to register in school or apply for a job with a name or gender expression that again doesn't align with who that youth actually are. So yeah, it's a long process. As a example for our clinic, we currently have wait lists that are anywhere from 1 to 2 years, and this is pretty typical across Canada in some of the research studies that I've been part of. And we look at the pathway to care that youth need to actually follow. Usually there's interactions with their family physician, community mental health providers like psychologists, well before they even make it to a gender clinic or a gender affirming provider. And even when they actually do get there, there's multidisciplinary assessments, there's longitudinal support provided, and each decision along the way is approached independently and with making sure everyone is on board, making sure that it's the most appropriate course of action for that youth, and giving youth time and space to let things sort of kind of crystallize almost, if you will.
And just, sorry, Erica,
no, go ahead.
I'll just ask one more and then turn it back over to you. In your experience, because this is, at least from advocacy groups who have been speaking out against these policies, the biggest reason is the risk that these individuals or these youth face should they not receive medical care or medical intervention or medical supports. In your experience, what is the risk?
I would say the risk is significant, and based on the balance of that risk, the risk of doing nothing, the vast majority of cases far outweighs the risk of whatever small risk of maybe negative outcome that gets sort of amplified in media or amplified by some of these personal narratives or stories. And so it's always that question mark of, doing nothing is not neutral. This is a conversation that any physician is going to have with their patient about any intervention. Here's the risk of us doing what I'm talking about, and here's the risk of we don't do anything at all. And that's for patients and families to decide for themselves what level of risk, what course of action aligns with their goals, and what is supported by their healthcare team. I think in particular when we're speaking about trans youth, though, the risk of mental health challenges is certainly quite high. We know that rates of depression, anxiety, suicidal thinking, suicide attempts is already higher at a baseline in the 2S LGBTQ youth population, but even higher when those youth do not have supportive parents, teachers, whoever, it's a community to support them. So that risk certainly can get amplified. We also know that there's other kind of social determinants based risks. So in terms of being underhoused, homeless, challenges with substances, right? All of the high risk sexual behaviors, right? This also can be something that occurs. So yeah, we definitely take that balance of risk quite seriously, and it's sort of a no-brainer at the end of the day when you compare. Nothing is going to be 100%, nothing is going to be perfect, but when you compare both of those potential outcomes, especially when you're talking about an intervention like pubertal suppression that is really, for all intents and purposes, 100% reversible, it becomes even more clear that is can be potentially a very life-saving and a very affirming intervention.
I want to jump in on one of the things that you just said of life-saving. First off, I don't think that either side of this is looking for no action. I think that there is action to work towards how we can support these individuals in that transition and what timeline that looks like. So I think it's just how we're getting there that maybe is the difference from people that support the policies that people that don't. But in no means is this government not taking action to address such a critical topic right now. But I want to come back to what you said about the life saving. So, and I'm happy if you want to send, and I will post it after on any articles. Like, I have seen no scientific data that has actually said that these claim to be a life-saving care. And what I mean by that is on the correlation between mental health, if you're depressed, if you have ADHD, and other terms like that, the hormone therapy or other forms of transition are directly correlated. So I want to get your thoughts on that, because I've also looked at the risks of taking hormone blockers, and mental health is there. I have a list. There's mental health, osteoporosis, mood disorders, seizures, cognitive impairment, and also when combined with cross-sex hormones, there's questions of being sterile. So when we're looking at the risks on both sides, can you maybe talk about, I think both sides have risks, and maybe I could get you to expand on that, because you did reference life-saving care, and I just want to make sure I understand what you said. And again, if you have documentation supporting that, by all means pass to me, as I'm going to share with you an Oxford University study that talks about exactly why the UK is shifting, and it's not because of how that clinic operated.
Yeah, and I recognize there likely are multifactorial reasons for some of those policy decisions in other countries. But yeah, I mean, to answer your question there, Eric, I think the life-savingness of those interventions, the most kind of concrete example, of course, is in the reduction of suicidal thinking and suicide attempts. And there is very clear Canadian data actually to support that. Gender affirming care, in fact, does lower that. So, I mean, I'm happy to share that with you, of course, off air here. But I think that's probably one of the most salient kind of high level risk reduction strategies that we know does exist. And I think when we say life saving, I'm using that phrasing to describe not only promoting the longevity of someone's life, but the quality of their life too. And we know that access to gender affirming care, including puberty blockers, hormone therapy, surgeries, without a doubt does improve mental health outcomes. Now, you may find, an odd study here or there that says, well, the evidence is inconclusive, or but really those studies are basically looking for a holy grail of, was this a double-blind, randomized controlled trial looking at the effects of puberty blockers or hormones, and that just doesn't exist, and it's not really ethical for that to exist in this particular line of care. There's many fields in medicine that do not rely on double-blind, randomized control data that are still best practice, that are still supported by international guidelines and sort of practice standards. So there is certainly a risk of not doing something, and a risk of doing something. And to your question about the risk of puberty blockers themselves, I don't think anyone is saying that they are without risk. What I am saying is they are entirely reversible. So to the government's point of these policies are being enacted to ensure and prevent youth from making irreversible decisions that are going to impact things down the road, but then banning puberty blockers beyond a certain age, to me, that directly conflicts with that stated objective and goal, that we would want to preserve access to the most reversible interventions before moving on to something else. And so the risk of harm here is setting an arbitrary age cutoff where the majority of people are already have gone through puberty, and then say, oh, now you can have access to puberty blockers, but you've already, you're 95% of the way through, that there's tremendous risk of that, and risk of, well, now we've set someone on a path that maybe they actually need to pursue gender affirming surgery, more likely, or maybe they're more desiring to pursue gender affirming hormone care because their body's shifted in a way that's not affirming or not aligned with them. So there's risk to that as well. The actual risk of puberty blockers themselves. So these are medications that we're talking about in the context of gender affirming care. These actually get used for a number of things across medicine. Treatment of prostate cancers and other malignancies, endometriosis, PMDD, precocious puberty, and other certain conditions to suppress sex drive. So to highlight the laundry list of potential side effects, sure, those are there, but these are not things that we commonly see in this population, because we're using them for a short amount of time, usually no more than 2 or 3 years, and then we allow youth to kind of go through whatever puberty is necessary for them. So we don't minimize the risk. We present the risk of some of those health changes, in particular osteoporosis, to youth and families, and we have strategies to mitigate that risk from actually affecting their health in a negative way or in a long-term consequence kind of way.
And I appreciate, and then sure, I promise I'll throw it back to you, but I just want to follow up on that because, you're showing from your expert opinion. I know Cheryl and I have been sharing articles and information and talking to individuals that are on the pro and against side of these policies. You talk about like the reversibility. The one thing that was brought to my attention by some parents that are concerned for their children if they enter into this and have explored it, and I recognize it's not an overnight thing that happens. And I know, I know they're off-label prescriptions, as you mentioned. I guess my question is around how when they're going into this process, can you ensure that I guess what I'm trying to say is there's not enough studies on the long-term impacts, and everything I've seen is 3 and 5 years or short-term puberty blockers. But I guess I came across the class action suit in the U.S. For Luberon. I'm not sure if I'm pronouncing that right. I'm not an expert, but that's on some of the impacts, the longer term effects that these had on individuals. And I recognize that's not in Canada. So maybe if you can talk about how the FDA's regulations and Canadians differ to bring some peace of mind to individuals seeing those types of cases, but also how we're ensuring that we're not heading down a road where the concern is that we don't have enough information, we don't have enough studies, we don't have enough evidence on the long-term impacts. And that was something that was consistently brought to me over the last week when we said that we were going to be talking about that. So maybe just shedding some light on that as well. Yeah,
absolutely. I think, again, at the end of the day, those sentiments, I think, are reflected by parents and families that we're working with on a regular basis. They want what's best for their child, and they want reassurance that their child is going to be happy and healthy. And so we present to them the best available evidence at that time. And we don't know the answers of someone who is on Lupron or Leuprolide, during puberty, what's going to happen 40 years from now, right? That study doesn't exist, and nor probably will it ever exist, because that's not how medicine necessarily works. There's a lot of good observational data and a lot of robust studies from that perspective that do support the benefits of these medications. And so we have to weigh that with a small percentage of risk of, there are some unknowns. And so, yes, there are, class action lawsuits in the US. I think you can find one for, most medications that are out or have been released, right? So Leuprolide is perhaps no different. But we really try to present things as fulsomely as possible, saying we don't know all the answers. We're never going to know 100% of the answers, but we have a pretty good idea, a good enough idea of here are the beneficial things that we would expect to happen. Here are the small risks that are known, and perhaps even the smaller risks of unknown, and let families and parents decide for themselves what actually makes the most sense. And so, from a parental rights sort of lens, and a lens that encourages patient and family agency and autonomy, allowing them to be the decision makers in their healthcare, as opposed to government saying yay or nay, or government involving themselves in the medical records or patient care. To me, that's really the most kind of jarring aspects of these proposed policies.
I know your time is limited, and we've talked about the long wait list, and I know you're heading off to make your way through that after we're done here. So just wrapping up with one question, which is sort of about the broader implications of what the government has announced. Medicine in Alberta, just like law, is policed, is self-governed. So the college sets the standards because we have all agreed as a society that experts in medicine are best positioned to set the standards of care and set professional standards as well. What we're seeing here is the government stepping into that and saying, now we will come between what the AMA has called a sacrosanct relationship between the patient and the doctor, and in some cases their parent, and decided what doctors can and cannot do. Just before we let you go here, your thoughts on what that overstep means in Alberta and what it could lead to down the road.
Yeah. I mean, I would echo a lot of the concerns and statements from my colleagues and our respective professional associations and regulatory bodies that there are a number of ethical guiding principles in healthcare, and patient autonomy is one of them. And that anytime government is trying to insert itself into the patient-physician relationship and sort of dictate what can and can't be done, it is worrisome. And the concern here, especially if government is not consulting with experts, is not consulting with the profession, and just sort of rolling out these policies that they feel are sort of good faith and in the best interest, without actually really knowing that not only creates a lot of potential harm, but it also sets some potential precedent to what's the next area of medicine or healthcare that government will feel empowered to insert itself into. What's the next area where they're going to dictate when an intervention, when a medication can be prescribed versus when it can't. And once those doors open, to me, that can be a bit of a slippery slope. So our hope is hopefully government is willing and expressing interest in consulting with experts, because that hasn't happened at all to date. So again, another reason why these announcements were so shocking, because it really flies in the face of the established guidelines that do exist in this area. But yeah, really worrisome, I think, for any healthcare providers to, have this, even if the door is just open a smidge, right? It's a little scary.
Dr. Raish, thank you so much for coming on the program. Thanks for lending your voice and your expertise to what is a very, very complex topic. So we really appreciate you being here.
My pleasure. Thank you both, to you, Cheryl and Erica.
Well, I think it was great to have Dr. Raish on. And I want to just start off by saying something that he was talking about is the consultation, which I think is going to be critical for the government between now and when the policies would be introduced as legislation in the fall. So still lots to see on how the government is going to navigate this. But I think it's important for our listeners to also see, one of the video that you mentioned, Cheryl, on X earlier, and how she approached this. We're going to flip to a clip right now on not just the policies, but her empathy and tone towards this topic.
As Premier of this province, I want every Albertan that identifies as transgender to know I care deeply about you and I accept you as you are. As long as I lead this province, I will ensure you are supported and your rights are protected.
And she goes on to, throughout, after she's listed the policies that I know we're going to go kind of one by one and dig through that. And it is to those children and teens, I want to say just how much we love you and support you in becoming the person you want to be. You have to feel, you never have to feel alone or isolated. It goes on for a couple more sentences. But I think the point is that what I've seen from the anti-policy argument is that this is a anti-trans, trans hating type of policy. But when you have the Premier coming, and I don't believe that this is ideological policy, I think this is, one of those very difficult policies that's timely, and she so happens to be the Premier of the province, coming forward and making a very tough decision and looking out, as she said, for protecting and the safety of children going through this.
I absolutely and completely disagree. I think that walking out a pre-produced video, her tone is great. The look on her face is practiced, and she has demonstrated many times that she has the ability to say anything while looking incredibly professional. But it is absolutely duplicitous to come out and offer, we love you, we stand with you, we support you, and we plan to bring in these policies that will ultimately hurt you, and ignore advice from the medical community. To do all of that at once, if I was a member of this community, I would be outraged, and I'm outraged on their behalf, because it doesn't matter how kindly she said it or how empathetic her tone was, it's dangerous and it will hurt people.
And I will say, I want to address that on 2 points. First off, during the questions afterwards, the Premier was asked about a personal experience and a family member that has, is going through gender identity, and I'm not sure any status, and it's not for me to speak on, but has someone in her family that is experiencing and navigating this. So what she was talking about, and I will say, I think that one was very authentic if you're going to criticize a pre-recorded speech. But when asked about that and the importance of family and the what she shared in her experience and that family members was the unknown, the lack of evidence. She shared the long-term impacts, and that ultimately, children are children, and there's guardians for a reason, was what she kind of what she was talking about, of the risks on the other side and why these policies were important for the government to put in place.
And every single person's story is authentic and matters, and I take nothing away from that person's experience or the fact that they chose to share it with Premier Smith. But I don't believe that any Premier anywhere should be bringing in policy based on one conversation with one person of any community. And so I think that person's voice really matters, and I think their experience matters. But in cases like this, we need to be relying on the experts and the medical professionals and the evidence that exists about how to treat patients, not on one-off conversations, no matter how close we are with the person who's offering their experience.
And I completely respect that. And like I said, we can all only bring our own lens and experience. And, for folks like you and I, we've been spending the time to have those conversations and understand. I think that for me is the biggest takeaway, is how much I've actually learned about from the community that's pro and anti of these government policies. I want to call you out though a little bit. There is equal science on the this is a science-based approach from a different part of science. And so I find it interesting because the NDP has always been like pro-science, pro-science, pro-science. And I completely agree with that. However, this is something where you're ignoring a significant portion of the science that talks about the impacts of potentially hormone blockers. We don't have evidence that's cited saying we have nothing against or no risk associated with this. To me, what I've heard from a lot of folks is their concern that we don't have the confidence in what is being said. And I'll also say, for the record, I don't believe every family physician is the expert in this. I believe there's individuals that are experts within this field, like the doctor we had on, that can speak directly to this. But I think we're blanketing what an expert is. And I would also argue that parents are experts in raising their children and in what is in the best interest, and that they love their children. So those are also a very big stakeholder group of experts.
But this policy is not asking anyone not to love their children. It's not saying that parents don't know their children best.
But then how can you say that we're anti-trans? It's not saying that either.
Because that's
an interpretation,
policy,
which is the same thing.
Okay, this policy, if a parent and a medical professional and a youth all agree this is the best course of action for them, the government has still blocked it. So that doesn't do anything for parental rights. In fact, that takes parental rights away. Those parents who say, I love my child, I know what's best for my child, and this route of medical intervention is what's best for my child, the government has said, no. We know better than doctors. We know better than parents, and we've decided this is not going to proceed.
At the age of 15.
That's taking rights away from everybody.
But at 15, that's not taking your rights away at 18, which, as the doctor said, is not something that we are looking at that 18-year-old. That is the age of maturity. I think where the government's trying to go and be proactive versus reactive is on the opportunity that a doctor or a physician currently has to deem an individual maturity of age, meaning that they don't have to be a certain age. And so what I think where some folks, or where the government's trying to put safeguards to reassure parents, is that if you start this 2-3 year journey that the doctor's talking about, that could start at 11. And then you add it up, and that I don't think we may disagree, but I don't think an 11-year-old has the same ability to make those tough decisions that they would at 20, at 30.
But with respect, Erica, who cares what you think? We have experts in all of these fields. We just had a psychiatrist on, and their job is for when patients come forward, no matter what age they are, to work with them on a medical level, on a psychiatric level, to work them through the process and decide what intervention is appropriate at what time. So for anyone on the outside, parent or otherwise, to look at someone else's situation and say, I don't think you're ready to make that decision, who cares what you think? This is why we have experts.
Okay, but what about the experts that don't feel they have a voice and can't say something because they don't agree with gender affirming care? And right now we default to that. So as a physician or as a psychologist or as anyone else that has to operate under the current rules, they also are getting silenced, and there isn't an opportunity for them to share their voice. The alternative, if they do, is the fear of losing their license, of being deemed unethical, their livelihood. So I do think that, yes, there's bodies that operate, but are they truly doing the due diligence in making sure that those experts that we're talking about can have that conversation? Because right now, my phone rang off the hook on people that didn't feel like they could have a voice because of the consequence. There was people that couldn't come on our show or have asked to go on background. And I'm not a journalist, but I appreciate their approach. Had very serious conversations, but I said, I don't want my story shared. I don't want this because I'm so scared that I will lose my license for having this opinion. And so I don't think that you can say that all experts feel this same way.
But is that person who's saying they don't want to speak out, are they an expert in gender affirming care? Yes. Or gender dysphoria?
And an individual that has gone through transition and detransitioned as well. I'm not typing it to one person. I've talked to numerous. And like I'm saying is, I don't I can't personally relate. So I tried to get as prepared for this as possible. And these were the concerns that were shared with me. So I don't think the system's perfect. I don't think the AMA putting a blanket statement is speaking for all of their members. They're speaking for the executive. And, pediatrics, like the AMA put a letter out. I'm sorry, but not all pediatricians have this expertise. And so I completely agree with you that who should be at that table are the actual experts that understand this type of topic and situation, because I think we're all working towards what is in the best interest of those children. And we want to protect them and love them and make them feel okay as they go through this journey. And I think that right now, how the medical profession is approaching it, there's a lot of criticism or lack of trust that that's speaking for all the experts.
And I'm sure there will always be outliers. I mean, we just heard from the doctor, you'll never find anything that's 100% conclusive. And part of that is because it's just not ethical to do those kind of studies, the gold standard of studies. But I'm sure you're right. I'm sure there are outliers in everything. But I mean, if we are not trusting the expert voices in Alberta, in this case, not even consulting them, I don't know how we make an informed policy going forward. And I would much rather hear even from experts who oppose the policy than have the government be the one to step in without proper consultation and make a sweeping plan with massive implications like this one.
And I think as we go forward with these consultations, as we talked about, it's really important to have all those voices at the table. Another group that I have not seen or heard from, and by all means, I'm happy to see that, but are those individuals that also may not feel they have a voice and they need to be at the table. Those individuals that detransitioned, or those people that regret their decision, or those that felt that there was, some gaps in the system when they were going through this, and we can learn from those situations. But to your point, I do think more consultation needs to happen. I feel like we say that on a lot of things, that consultation is always best, but I do think that the experts need to be at the table. And I think that includes individuals with their experience, and it needs to be a safe space where they're not going to lose their license and they're not going to hurt their brand and reputation or be exiled by another community because they're sharing their story and their experience.
Totally. And I would like to move to the politics of this, but I just wanted to say one more thing, because absolutely, let's hear from the full spectrum of voices, which we've heard, and you can see in even the studies that were shared with you, is a very small portion of the people who are participating in the studies and have transitioned have actually regretted their decisions or retransitioned back to the gender that they were born with. And I think those voices and those stories are very important, and we should hear from them. But let's remember that those on the other side, those who are at risk because they haven't received care or they won't receive care, or care has been withheld from them because of policies like this, many of them will not be able to share their experiences because they will have hurt themselves, because they will have harmed themselves, because they won't be with us to share those stories. And I think that's important to remember when you think about the things that Dr. Raish said. The risks of this kind of intervention, the risk of doing nothing is it just far outweighs it. And so just keeping in mind that so many of those people who haven't received care won't be able to share their experiences.
Yeah, and I know I want to move on. I'm sure we could keep talking about that specific side. Maybe coming to why the UCP did this. I've asked myself that question because, again, it's not ideological. It's a very, very, like you said, emotional, divisive topic. Even in polling, you see mostly people that support the policies or don't support the policies. There isn't even a huge number of I kind of support or I kind of don't. It's very, black or white on this topic. And so why? And I think it's because what we're seeing around the world, we saw it from other provinces, Saskatchewan and New Brunswick, and I know that there's obviously difference of what Alberta did, but we're seeing these changes that I talked about in UK, Sweden, Finland that are reversing some of their practices. And so I think the government was doing this in a proactive way to try and address an issue, not in a reactive way that I've seen how the NDP has really politicized this.
But can I just summarize what you just said? The government is trying to solve a problem that doesn't exist.
It does exist around the world. They're trying to get in front of it as opposed to waiting till we're at a place where we do have science. We do have stuff that's backing up what they're doing. And we do have kids going into sport that are concerned. We do see teachers having conversations without parental consent in classrooms. It's happening. We've talked about this.
There's no data to suggest that the government has to solve a problem. I mean, we
But that's
saw
what government's
Premier
job
Smith,
is. There is a problem.
No,
you solve
the
it. You're saying there's a problem.
There's no problem. There's no problem here. The government, like Premier Smith met with Vashi Kapelos earlier this week, who put her on the spot and said, are you worried about what's happening, or are you worrying about what could happen? And she said explicitly, I'm worried about what could happen. Like, we're not asking governments to come in and imagine problems for us to solve. There are so many problems that are much bigger in Alberta right now than this one. I would like to see the government keep their promise and make a tax cut. I would like to see the government fix the healthcare system. This is nowhere near the top of my list for priorities in Alberta, and certainly not even near the top of my list in terms of things they could do in the education system. So I don't understand why now and what the impetus is to make such a giant leap on an incredibly divisive topic.
I don't disagree that it's divisive. I think that similar to conversations around abortion, conversations around gay marriage, conversations around homosexuality, having those types of conversations because they're happening in your society, there's never a right time, and it's never easy for a politician or anyone to address. But sometimes there's the right time because you need to start having those conversations. And when parents were coming home, looking at what was happening to under their nose, that they didn't know about their children and they wanted to love and support them. That's, I think, where this is coming from, is that there's lots of individuals that disagree what was currently happening. And as a government, they want to get in front of it. Now,
but I'll wait to see examples, because this is what happened in Saskatchewan, too. If we're talking specifically about pronoun notification, the government was put on the spot and said, tell us, like, where are these people? Where are these parents? Like, where is the problem? And they came up with nothing. So, like, we can imagine a problem for sure. And we can imagine a villain. But in this case, I've seen not one example of anyone saying this policy needs to be introduced.
I would probably argue against that. I would say we have teenagers or preteens in our house. We see what they're being told and said in school. I'm not the only family, and you can tell me you don't care about my experience, but all I can bring is my lens to this. We've seen kids being confused of why they're being asked their pronouns. As a parent, we'd love to have that conversation of why it's important, why it's being asked, what's happening in society, that this is the way we're moving towards, things like that. And if you don't know, or you don't know what your children are being taught, and you don't have an opportunity to opt in, that is where I think the concern is. And I think that there's a lot more people than you think that at the end of the day love their children, want to support them. And I know you guys argue that that's not what this is about, but you've really actually, in the way that the NDP have gone about this, have victimized parents and almost has said by default they're not equipped to raise their own children.
So first, I'm not here on behalf of the NDP.
I recognize that, but you know more insights into their workings.
But I've never said that parents shouldn't love their kids, that they shouldn't care about what's going on in their lives, that they shouldn't want to know what they're being taught in school. I think those are all very reasonable expectations. And certainly as a parent, I have those expectations myself. What we're talking about in this specific case is about kids who are at risk. So we're not talking about you, Erica. We're not talking about me as a parent. We're talking about kids that cannot be honest with their parents because they'll be hurt, because they'll be harmed, because they will have to leave their house. And that is who is protected as it stands. And that is who will not be protected if these policies move forward. And even though they're a really small portion of the population, every single one of their lives matters, and their lives are put at risk if this policy is brought in. And that's what I'm worried about. All those other things are absolutely true. And in most cases, this policy won't apply. But in the few cases that it does, it really matters.
And I hear that, and I don't, like I said, I'm not here to discredit any of that, the minority of individuals that are navigating this. But where can our resources go to solve that problem? And I think it is bringing in experts, having clinics specific to that. I don't think teachers should have to be the ones that are navigating this. They don't have an expertise in it. They don't have training. That's a very difficult thing to have a conversation with a young person about. A child that, you're always scared that you're going to say something wrong, in those types of situations. So, I look forward to seeing how the government is going to address what resources or supports can they give both those children and all children. But I think right now what we're seeing is a landscape where a lot of people, and when you look at the polling, and we'll see if it stays, but a lot of people are looking through their lens, their personal lens. And I feel like we have an environment where if you say that you support these policies, you all of a sudden are, a horrible person, a bigot. I've seen the stuff on social media. There's not a lot of people that support these policies that are tweeting about it, but the polling suggests that there's more people that agree with this because all we can do is come with our own lens. And the perspective that I think a lot of Albertans are coming with on this issue, and where I think the mark is being missed by how the NDP strategy is politicizing this, is that people are parents and they see this and they can only come, and all we can ask people is to come from your own view. And that's where I think we're seeing a large amount of support for these policies, because we all are like looking through the lens of a parent and what we would do if our children were in that situation. And we look at it and it's like, of course we'd love and be compassionate with them and help them through this. And so I think where some of the pronouns and the sexual education and those types of policies, that's that lens. I don't know if we'd call it parental rights when it comes to the gender reassignment or the hormone blockers. But I'll let you jump, and then I just want to cover off the sports, because I know that was the last piece of those policies.
Sure. I mean, I completely agree. I think that on both sides of this issue, the conversation is highly, highly politicized and wants to put people into pro or con boxes or right or wrong boxes. And I think that this issue is absolutely incredibly complex, and it's hard to navigate where your position is or where the right side of history is on it for certain pieces of the policy. But conversations where we can actually look at the facts and where we can rely on experts and where we can have real conversations and feel safe asking questions get us closer to having a real conversation, because I completely agree. It's hard to talk to anyone about this right now, and it's hard to seek information on it without feeling like maybe you've misstepped. So I think opening channels to have real conversations about what the implications and what the risks are a benefit to everybody.
Yeah, and I completely agree with you on that. I know both of us talked about not wanting to use incorrect terms, being very, educated on the topic, not wanting to offend anyone, and not coming from any other place but care and compassion for this. But you are right. It is hard to talk about. I think that there's facts on both sides. I don't know where this is going to go in the polling, because it seems like a lot of people have decided one way or the other, and we're not here to have people flip-flop or decide anything that's not authentic to them. But I guess the biggest thing to take away from this is, if we can do this and have these types of conversations, that it is possible, and to educate yourself on a lot of what the policies mean. And, again, the spectrum of the policies is quite robust. And yeah, it's just, where do we go from here? Because we're going to see what's going to happen in the public opinion towards it. We're going to see how the government navigates this. But before we end the show today, I just want to get your thoughts on the sports one. I think we might be ending on maybe one of the the easier topics or easier parts of this policy. But where do you see, I haven't heard the NDP, and I know you don't work for them, but even just the strategy behind it, they haven't really pointed to, they obviously won't talk about some of the pre and post operative transgender care that the government's looking at, or the pros potentially of this policy. Do you feel like from the NDP, their strategy is just to say no to all of these policies, or can they understand maybe something like the disadvantages of biological men or boys playing in girl sports?
I think you'll see the NDP say that all of these policies are harmful, with the exception of trying to recruit specialists to Alberta. And I mean, that goes to a lot of the relationships they have with the LGBTQ community, a lot of the experiences of those people. And honestly, the science and the standards that have been set for competitive sports for transgender athletes at the highest level. So I think you will absolutely continue to see Rachel Notley and whoever succeeds her continue to quite passionately oppose all of these policies, with, like I said, the exception of, I think we can all agree we would benefit from having more specialists and more care in Alberta.
So how do you think they're going to navigate the fact that the World Athletics has come out? They recognize that going forward there will be an open category. I'm not quite sure, but that they will no longer allow biological men to compete in women's sport of that level. And so that includes the World Para Athletics. I know that Dr. Linda Blade, president of the Alberta Athletics, has spoken quite widely about this topic. And I know the government said that they're going to be working with those stakeholders to navigate. But how do you see, if this is the experts within that field, how do you see the NDP, if they're going off of this science and relying on experts, that they can say that this policy and approach that has a lot of evidence supporting the biological disadvantages, and that women are actually disadvantaged by having men be able to compete in their sports? How do you think they're going to be able to justify that?
Well, I think it's pretty easily justifiable. I mean, there's kind of two things we're talking about here. One is like competitive, absolutely top level competitive sport, which I think is in a different category, not on this policy, but on all policies in terms of eligibility. But then we're talking about recreational sport between kids. And in that case, like, I just don't think any of this is necessary. I don't think that any kid that wants to play with their peers should have to defend their gender or their place in society before they're allowed to play with them. So let's just start there. I don't want to, when we talk about creating other leagues for transgender individuals, that just segregates them. That just makes them other, and that just continues a false narrative that their very being is somehow malicious. And then if we want to talk about the very upper levels of competitive sport, I think we should look to the Olympics, that has said that no matter your gender identity, it will not discriminate you, and has laid out very specific guidelines in terms of testosterone levels over the course of the year before competition to allow transgender athletes to participate, and has said outside of that, no one has to disclose, and all male athletes that have transitioned to female will be eligible to participate at the Olympic level. So, I mean, if it's good enough for the Olympics, I mean, they're basing it completely on science and experts and academic backing. And I think that we should look to them in competitive cases for guidance.
But we don't measure testosterone levels in junior high and high school students. So I guess I'm looking at it, but the safety of it, I think, is where some parents are concerned. And that is around the fact that I'm quite a strong individual. I don't believe that let's just take some example, a 16-year-old girl that could be very strong, playing basketball, a contact sport, playing against a 16-year-old boy that's now is in transition, identifies as a female, but is a biological male. How do you explain that that's safe? There's a lot of strength. It's been proven. So I guess my question is, how do you say that that's not putting the female at risk of being injured? I just think this is such a false narrative that anyone who decides to transition is risking the safety and security of the people around them. Like in basketball, for example, or any sport, there will always be women who are much different sizes and weights. But that's very different. That is very different.
There will always be people who play rougher, and that is exactly why we have rules in sport. That's exactly why we have referees. There will always be a difference between size. And I've played sports my whole life. There's tiny women and there's giant women, and there will always be a mismatch in terms of their strength.
Right, but I think that the argument is that science has proven that males are physically stronger than females. Therefore, a female versus a male, the female is majority of the time not as strong as the male, at the same age, same everything. And I think the argument is that you make this policy, and then who else are you then, as a result of that policy, disadvantaging? And I think that's the argument.
But who cares? It's a junior high sport.
That cares, like parents that have kids that get hurt in this.
No, but we're not
kids that don't get their scholarships.
Are we talking about kids in junior high basketball, junior high? Okay, like I'm just saying, in most cases, if we're talking about competitive, let's look to the Olympics as the standard to set. If we're talking about recreational sports, are we really going to say, we don't want you to identify as your authentic self or be a part of this community or be treated like a woman because that we might not win our recreational game that way? I think for parents, I think it's more about the safety because of the clear strength versus the winning and getting the trophy. But I do think that there is
like when you get farther down the line, scholarships, things that would maybe disadvantage you. We've seen it in swimming. We've seen it in Olympic lifting. And I get that that's not the Olympics nor these athletic sports. I think where it comes to is, again, the force and strength that these individuals have and the concern that someone is going to get hurt. And I do think there's sports, again, those are contact. I've seen in the trail running community, they'll have an open category. And I mean, this is a field where men and women and everyone runs at the same time. So I do think that there's ways in sports to make it so that it is not an alienation of any individual or making an individual that's part of a minority group feel different. But I do think you've got to look at the whole scope of all the people impacted and address it accordingly.
We didn't spend a lot of time touching on the politics of this, but we have covered the policy.
I think we shared the politics
in quite a bit of detail, and perhaps we have communicated the politics through our tone and wording on each side of the conversation today. But I think for those who have really engaged with this topic and been sending in information or points of view or articles, I'm happy to keep receiving those. And watch for us, like we said, new time every Thursday morning at 5 a.m. Or you can find us on YouTube and wherever you get your podcasts.
The Discourse is hosted by Cheryl Oates and Erica Barudis. Follow on Instagram at The Discourse Pod. Subscribe to The Discourse on YouTube and wherever you get your podcasts.